Wuhan and Hubei province remains the epicenter with the largest number of cases, but there are now reports from across China, and it has spread to Hong Kong and elsewhere in Asia, and further still to the United States, Australia and France, where 3 patients have now tested positive.
Today, China's President Xi Jinping warned it was spreading. And indeed, scientists at Imperial College London suggest as many as 4,000 people were infected by January the 18th, and that each person was infecting as many as 3 others, showing how hard this will be to contain. All transport in and out of Wuhan has been stopped. From tomorrow, all vehicle use, including private cars, will be banned from downtown. In the city of 11 million, 6,000 taxis will be deployed to help people get around. It is in quarantine. In Hong Kong, where they have had 5 cases, today the government announced it was raising its emergency response to the highest level, with schools to remain closed for 2 more weeks after the Lunar New Year celebrations.
We need to step up our immigration control. We have to control the spread of the disease. First of all, we're going to stop flights and high-speed trains from Wuhan. We will wait until we're fully in control of the outbreak before we resume flights, as well as the high-speed train service.
31 people in the UK have been tested, but all are negative. Public health teams have been placed at Heathrow Airport in London for any passengers feeling unwell. And Channel 4 News understands that medical teams will also be placed at other major airports around the country over the next few days. Yet China remains the focus of this outbreak. In Wuhan, their medical facilities are being overwhelmed. They're now building 2 new hospitals to cope, and the Chinese military has sent in 450 medical staff. So there is no vaccine for this new virus, which has never been seen in humans before. Experts are concerned about how it might mutate. The symptoms include a dry cough and a fever, but people can remain asymptomatic, unaware that they can spread the disease. Tonight, China announced it was suspending tour groups from leaving the country, and the French and Americans are planning to evacuate their citizens from Wuhan, with other embassies in discussions with the local authorities. The increase in the official numbers itself is not currently a sign that the crisis is worsening. It could reflect better monitoring and detection, but nobody is taking any chances.
Where I am is usually quite a busy street, but if you were to look outside now, you would have no idea it's Chinese New Year. It's like a ghost town out there.
And I mean, how does that feel?
It's hard to describe because there's nothing's ever prepared me for anything like this. It's as if I'm in a dystopian movie. It's hard, like there's 10 million people in the city and there's no one on the street. And from midnight to night, they're banning all transport. So no personal vehicles unless absolutely essential. So there'll be nothing out there tomorrow.
Now, you seem quite calm, given what you're describing. Is there any sense of panic?
As the days go by, the panic seems to be increasing. I try to not worry until it's time to worry. There's no point worrying now. I'm not sick now. I'll worry if I get sick. But yesterday, in an American group chat, the people were freaking out a little bit. Today, just a few minutes ago, people in the British group chat, they were freaking out because the UK government don't appear to be doing anything, while the French and the American governments look like they're taking action for their citizens.
Yes, now, I know your stories appeared in the Irish press. Have you heard at all from Irish diplomatic services? Are they giving you any advice? Are they getting in touch to see how you are?
I haven't heard anything from anyone, but I also haven't tried to reach out because it's also Chinese New Year. So, consulates and embassies, they're not open today. But for Ireland, I haven't heard from anyone, but I haven't tried to reach anyone. I don't think it makes sense to leave. We're here. And if we left, we would feel better. But then we're only risking spreading the disease.
You're there on your own, as I understand it. What, if any, precautions can you take, or are you being told to take, to prevent catching this virus?
Well, the best thing to do is stay at home. But unfortunately, that's just not possible the whole time. So when you do go outside, I actually wear swimming goggles, would you believe it? Because that's how the doctors and nurses have been infected, because they're being infected through their eyes. They took precautions for their mouths with masks, but the doctors and nurses were infected in the hospitals through their eyes. So now when I go out, I wear 2 masks and a pair of swimming goggles. It looks silly, but it's the safest way to do it.
And how often are you venturing out? Presumably you need supplies.
I will be going out first thing in the morning for what I can only describe as a massive shop, because I don't want to have to go out again for a very long time. I plan on bringing my suitcase to the shop so that I can get enough stuff. And that's it. After that, I don't plan on leaving for weeks.
So you are literally anticipating having to stay in your flat alone with this stockpile of food ad infinitum at the moment.
Yeah, that's it. I got a message from my work and all transport into Wuhan is indefinitely shut down. We don't know when. We have no idea when the end is coming.
Because I assume even if you wanted to leave to try to make your way back home or somewhere else, you couldn't at the moment.
No, that's impossible. That's why people are so upset. And the Americans and the British are very upset at the moment, because there is no way out. We're in a quarantine city, and that's just the way it has to be. Otherwise, we risk spreading this disease further afield. Like, it's already global.
Well, we wish you to stay safe and sane. Thank you very much for talking to us today.
Thanks for having me. Thank you.